I know there's a bunch of pregnancy vlogs out there right now, and everybody, I guess, has something different to offer because every single pregnancy is different. And this is my 5th pregnancy where I've made it to the 2nd trimester. And with my last one, I got something afterwards or during, which I didn't realize, called Diastasis Recti. I'm not sure if I'm pronouncing that right. But basically it's just that the muscles have separated and they wouldn't go back together again afterwards. So this pregnancy has been a little different than my others because of that. But there are a number of things that are similar, at least to my my 4th child that I have here. And one of those things being that I don't have as many pregnancy symptoms throughout the pregnancy as I did with my first 3. One of the things that I noticed with this pregnancy, especially a lot earlier on than I did with, well, I noticed with my last one as well, but it wasn't as bad as this one, and it wasn't as early as this one, is that the top of my stomach is where I'm feeling the most of my discomfort. Usually everybody, we talk about how like it all feels like it's just hanging out, it just hurts, and because the muscles begin to separate and whatnot. That's normal for pregnancy, but what I've been getting is right up here, because my issues go from my navel upwards. I have a separation before I got pregnant of about between 2 and 3 fingers, but 2.5 fingers. It wasn't huge, but it was enough that it would cause me issues. So what I have right now is they're about, my muscles are about this far apart, and I find up here I get like a tingling, kind of like, oh, I don't even know how to describe it. It's just a tingling discomfort sensation. It feels, I've had it where it actually feels like the muscles are ripping apart, which is not painful per se, it's just weird. When I was about 16 weeks, between 14 and 16 weeks, I can't remember anymore, that's when I was starting to feel the separation, when I would pick up one of my kids, because I have a 4-year-old and a 2-year-old, and they like to get picked up a lot. So I'd pick one of them up, and then all of a sudden I could feel this like a zipper, like all the way up, and I just did not feel good at all. So I was like, okay, I'm not picking you up, especially when you pick and twist at the same time. Doesn't work. Can't do that anymore. So that's the weirdest thing that I've been finding with this pregnancy. Oh, I just wanted to show you guys about the Diastasis Recti. I'm wearing the ugliest pants known to man right now. I don't know if you can see, I can't tell, but here's my stomach. It's my 23-week belly. I feel like I'm pretty big, but whatever. But I don't know if you can see this, but if I tilt back, you can see this bump that forms here. I don't know if you can tell. It just goes like that. That is because there's no muscle there. My muscles stop here. So everything just kind of pushes out. There's like nothing. It's literally, there's nothing there. Here there's muscle, and then there's nothing. So that's what that muscle separation does. I noticed it when I was like after I had my last baby. I noticed that's when I figured out what I had, because I wasn't going back to normal very quickly at all. It was a good month after she was born, and I was still getting comments like, "Oh, when are you due?" And I'm like, I got a newborn baby right here. I'm not pregnant. There was a couple of gentlemen actually making comments like, "Oh, you're getting, just let yourself go," or "She's pregnant, right? Not fat," and stuff like that. And hearing a comment once in a while, it's just like, whatever, no big deal. But every single week, like every time I went out into public, pretty much, it begins to bother you. Even if you don't normally get bothered by that sort of thing, it begins to wear on you. So I started looking into it, because I was the same weight already that I was prior to getting pregnant. I had lost all the pregnancy weight. I was already back to my original weight. So I'm like, something is wrong, like something's not right. So I went and looked looked into it, and that's when I found out about diastasis. And I did the measuring, and the way you measure is you lay down and you bend your knees, and then you just kind of feel in your stomach. You lift your head a little bit, and then you can kind of feel the muscles contract, and then you can kind of put your fingers in, and you can push your fingers in if there's a gap. You can literally push them in, and I found the gap, and I was at that point 4 or 5 fingers wide, if not a little wider. And so I was like, okay, we know now what the problem is. So then I had to put, I have a belt that's not really functioning well anymore because I've worn it out. And I would just kind of wear it at home, and it would help to remind me to sit up straight, because good posture is very important in healing that. So it would help me to sit up straight, and it would help me to remember to draw my stomach muscles together, like not just towards your, you know, like sucking in, but like bringing them to your spine, because then they move together, and they kind of move towards your spine at the same time. And by doing that for a while, it took a number of months before I started noticing that things were coming back together. The thing with mine that is odd, at least I think it's odd, maybe it's not actually, mine is up here, like from up here down to about my navel. And for most people that I've seen talking about it at all, it's the lower part that's separated. And for me, the lower part is easier to hide, because you can buy things for that will kind of help push everything together down the lower area. But for the upper stomach, it's very hard to find something that will help you merge the muscles together. So my lower muscles, they came together pretty quickly. Like I've noticed when I would lay down and I would measure, they were perfectly back together. There was nothing separating them. But then the second I got to my belly button, then they were separated. I can't actually show you how to do the measurements right now, because I'm not supposed to lie on my back. That was something that I found weird when I was my 20-week appointment. Was it 20? It was 20 weeks. I lay down to do the doctor took the Doppler to find the baby's heart rate, and he found one, and he was like, "That's slow." He goes and he feels my pulse, and it was faster than my pulse, but it was incredibly slow. And so we just kind of waited, and it started speeding back up. And then it was a normal, like a 136 or something like that. And my doctor's like, okay, baby doesn't like it when you lie down on your back, because either the baby pinched something, or like maybe the baby was holding on to the umbilical at the time, and I don't know. But the heart rate slowed considerably, because that was, I was hearing it too. I'm like, that's not the baby, is it? Because that was very slow. But it doesn't seem to be a big concern. Like, my doctor wasn't overly concerned. He just says, do not lay on your back, because obviously baby doesn't like it. So that's something that has been interesting, because for some really strange reason, this pregnancy, not with any of my others, I want to sleep on my back. It's like, why would I want to sleep on my back? Because if I sit even for too long, my legs start to go numb. I'm like, why would I want to sleep on my back? That's just gonna cause issues. But I don't know. So I have been making sure I stick things behind my back when I sleep, just to make sure that I don't accidentally go on my back. Because in the beginning of my pregnancy, I would find myself waking up on my back sometimes, and then with the diastasis, you can't roll over. I've tried, like, you have to literally, you have to grab onto the bed and pull yourself, and use your legs to push yourself to get up when the separation is too big. Right now, I can still kind of roll over, but I don't have any core strength. My core is so. Right after my 2-year-old was born, I literally had one day when I was sleeping in bed, and my 4-year-old, who was then almost 2, she wasn't quite 2 yet, the kids' bedrooms are upstairs, and she started crying. And I hear her in the monitor. I'm like, oh, I gotta go take care of my child. Anyways, all I remember is I was trying to roll over and I couldn't. So I'm smacking my husband on the side of me. I'm like, you kind of have to get up and go take care of the kid, because I can't get up. I can't roll over. So he's all groggy and sleepy, and so he gets up and he goes upstairs. I'm like, you can roll me over. I can't roll over, because what if the other one starts crying and I can't go to her? So yeah, that was interesting. I at that point decided I was not sleeping on my back anymore. You can't even sit up. I couldn't even, from lying down to sitting up, I literally had to use my arms to push myself upwards, because there was nothing there. Like all my muscles had gone completely off like this. And sticking out a lot further than I did with any of my others. I actually have a 20-week comparison photo for all 5 of my pregnancies so far. My first one I didn't make it to 20 weeks, so I don't have anything for that one. But yeah, so I'm a lot bigger. I'm sticking out a lot further this time.